are common prescriptions, silently harming memory in seniors. As Dr. Kenji Sato, I need to share a vital warning about drugs many over 60 take daily. Hello, I'm Dr. Kenji Sato, and welcome to the Senior Wellness Center. Here, we're dedicated to empowering you with knowledge for vibrant health and sharp minds throughout your senior years. Today, we tackle a crucial topic often overlooked: how everyday medications might be impacting your most precious asset, your memory. Many seniors worry about forgetfulness, misplacing keys, forgetting names. Often, it's dismissed as just a normal part of getting older, but is it always? What few realize is that some very common, everyday medications might be causing a silent deterioration of your memory and cognitive function over time. These are pills, often taken for years, prescribed for conditions completely unrelated to the brain, and considered perfectly safe for long-term use. But the slow, cumulative impact can be significant. Good news: knowledge is power. Today, we'll uncover the hidden risks of 5 common medication types. More importantly, we'll explore safer alternatives and practical strategies you can discuss with your doctor to protect your precious brain health for years to come. First on our list are proton pump inhibitors, or PPI. You probably know them by names like omeprazole, Prilosec, or Millions take these daily for acid reflux. They work by strongly reducing stomach acid, bringing relief from heartburn. But this acid isn't just for digestion. It's crucial for absorbing vital nutrients your brain desperately needs. Long-term PPI use significantly hinders the absorption of vitamin B12 and magnesium. Let's see why that matters for your memory. Vitamin B12 is essential for maintaining the myelin sheath, the protective coating around your nerves, like insulation on electrical wires. Without enough B12, nerve signals slow down, leading directly to symptoms like mental confusion, memory fog, and persistent fatigue. Your brain's wiring essentially starts short-circuiting. Magnesium is involved in over 300 bodily processes, many critical for brain function, including neurotransmitter activity and energy production. A deficiency common with long-term PPI use can manifest as irritability, anxiety, difficulty concentrating, and even more severe memory issues. Worryingly, studies suggest that using PPIs for several years is linked to a significantly higher risk of developing dementia. The effect is subtle, cumulative, but concerning. So, if you've been on PPIs long-term under medical advice, it's vital to discuss monitoring your B12 and magnesium levels with your doctor. Should supplementation be needed, ask about high-quality, bioavailable forms like methylcobalamin for B12 or magnesium. Check the description for examples. Simple dietary changes, like avoiding trigger foods and eating smaller meals, can often reduce reflux naturally. For occasional relief, H2 blockers like famotidine might be a safer short-term option, but always make these changes in partnership with your healthcare provider. Never stop your prescribed medication on your own. Next up, These are often prescribed for anxiety or insomnia. Common names include diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax. They provide quick relief by enhancing your brain's natural calming neurotransmitter, essentially hitting the brakes on anxiety. But here's the danger. With chronic use, the brain becomes dependent on this artificial braking. It forgets how to regulate itself naturally, losing mental agility. It's like constantly driving with the handbrake slightly engaged. The car moves, but not with the responsiveness it should have. Alarming research links long-term benzodiazepine use, even just for several months, to a substantially higher risk of developing dementia later in life. Beyond dementia risk, these drugs can impair neuroplasticity, hindering your brain's ability to learn and adapt. They often cause daytime drowsiness, impacting alertness. They also affect balance and coordination, significantly increasing the risk of dangerous falls in seniors. Paradoxically, while they help induce sleep, they often suppress the deep, restorative REM sleep phase, which is vital for memory consolidation and brain cleanup. Thankfully, there are effective alternatives. Cognitive behavioral therapy (CBT) is highly successful for anxiety and insomnia, teaching the brain new coping skills. Regular practice of relaxation techniques like deep breathing or meditation can naturally calm the nervous system. Consistent physical exercise is also a powerful mood regulator. Even simple, natural options like certain herbal teas, perhaps chamomile or valerian root, can support relaxation before bed when used appropriately. See description examples. These approaches strengthen your brain's own ability to find calm, reducing the need for medications that carry such heavy long-term risks. Again, discuss options with your doctor. The third group is tricky. These aren't just one type of pill, but rather a property found in many common medications, often hidden in plain sight. Think of drugs containing diphenhydramine like Benadryl used for allergies or sleep, oxybutynin for bladder control, or even ingredients in some older antidepressants and cold remedies. Their main action? Blocking acetylcholine, a vital neurotransmitter. Think of it as the premium engine oil for your brain, essential for memory, learning, and sharp focus. When acetylcholine is blocked consistently, it's like running your brain's engine with insufficient oil. Things start to grind, function poorly, and eventually, permanent damage can occur. Studies show a strong link between long-term cumulative use of strong anticholinergic drugs and a significantly increased risk of dementia. Worryingly, some of this damage might be irreversible. Beyond memory blocking, acetylcholine causes other noticeable effects: difficulty concentrating, brain fog, drowsiness, confusion, even physical symptoms like dry mouth and constipation. So, what are the safer approaches? For allergies or occasional sleep issues, newer generation antihistamines often have much less impact on the brain as they don't cross the blood-brain barrier. For bladder control, discuss lifestyle adjustments and pelvic floor exercises with your doctor before resorting to long-term anticholinergic medications. And for sleep, prioritizing good sleep hygiene, like a cool, dark room and consistent bedtime, along with relaxation techniques, often works wonders without cognitive side effects. Always check labels, especially on over-the-counter products, and talk to your pharmacist or doctor about the anticholinergic potential of all your medications. Awareness is the first step in avoiding this hidden threat to your cognitive health. Fourth on our list, certain calcium channel blockers. CC medications like amlodipine, Norvasc, or nifedipine Procardia are widely used to treat high blood pressure. Now, controlling blood pressure is absolutely vital. It's one of the best ways to protect your brain from devastating strokes. So, these medications can be however, there's a delicate balance. Some CCBs, while effective for blood pressure, might pose a subtle, long-term risk to cognitive function. Here's why. CCBs work by blocking calcium channels in the muscle cells of your blood vessel walls, helping them relax and lower pressure. That's the intended benefit. But these calcium channels also exist in your brain, playing a key role in neuron communication, neurotransmitter release, and the brain's ability to adapt and learn plasticity. Blocking these channels in the brain can be like putting a dimmer switch on neuronal activity. Information flow slows down. Think of it like looking through slightly frosted glass. Studies suggest that long-term use of certain types of CCBs might be associated with an increased risk of cognitive decline or dementia compared to other blood pressure medications. Beyond memory, potential effects can include mental fatigue, a feeling of slower thinking or processing speed, and sometimes dizziness, especially when standing up quickly. So, what's the strategy? Again, never stop your blood pressure medication abruptly. Uncontrolled hypertension is a major risk. Instead, have an open conversation with your doctor. Ask if your specific CCB carries higher cognitive risks, and if alternatives like ACE inhibitors or ARBs might be suitable for you. These other classes effectively control blood pressure, often with potentially less long-term cognitive impact. Crucially, emphasize lifestyle changes. Regular aerobic exercise like brisk walking or swimming is fantastic for blood vessel health and pressure regulation. Adopting a DASH-style diet in potassium, magnesium, and fiber from fruits, vegetables, and whole grains, while low in sodium is proven to lower blood pressure naturally. Limiting alcohol intake also makes a significant difference. These lifestyle measures can sometimes reduce the need for medication or allow for lower doses. The goal is optimal blood pressure control, while minimizing any potential long-term risks to your sharp mind. It requires teamwork with your doctor. Finally, let's discuss statins. Drugs like atorvastatin Lipitor or simvastatin Zocor are among the most prescribed medications globally, used to lower high cholesterol. They are incredibly effective at reducing the risk of heart attacks and strokes, playing a vital role in cardiovascular health. But again, there's a potential cognitive downside to consider. Your brain is about 60% fat, and cholesterol is a crucial building block for healthy neuron membranes, ensuring smooth communication. Statins work by reducing cholesterol production. While good for your arteries, some statins can cross the blood-brain barrier and reduce the cholesterol inside your brain too. It's like a builder trying to maintain a house while someone keeps taking away essential bricks and mortars. Over time, the structure weakens. Even more significantly, statins interfere with your body's production of coenzyme Q10, a vital molecule for generating energy within all your cells, especially brain cells. Without enough CoQ10, your brain cells lack the energy to function optimally. Imagine trying to run a high-performance car on cheap, diluted fuel. It runs slow. This combination, potentially lower brain cholesterol and reduced CoQ10 energy, can lead to symptoms like brain fog, memory problems, mental confusion, and persistent fatigue. The FDA has even required warnings about these potential cognitive side effects on statin labels, though they are often under-discussed. So, what can you do? As always, never stop taking your statin without your doctor's explicit guidance. The heart benefits are often critical. Discuss the necessity and dosage of your statin with your doctor. Ask if a different type, perhaps a hydrophilic statin, less likely to cross the blood-brain barrier, might be an option. Crucially, talk to your doctor about supplementing with CoQ10, often in the ubiquinol form, to support brain cellular energy. I've included examples in the description. Lifestyle changes are also powerful allies. Adopt a brain-healthy diet rich in fiber and healthy fats like omega-3 south from fatty fish, nuts, and seeds. See description for omega-3 ideas. Regular physical exercise helps regulate cholesterol naturally and boosts brain health overall. Some natural supplements like red yeast rice or berberine have shown potential in studies for cholesterol management, but always discuss these with your doctor before trying them. The goal is a balanced approach, managing cholesterol effectively while actively supporting your brain's energy and structure through informed choices and doctor collaboration. Now, remember I mentioned a surprise item at the beginning. Something incredibly common, maybe even part of your daily routine, that could also be affecting your brain health silently. That substance is caffeine. Yes, found in coffee, tea, sodas, energy drinks, even chocolate. We often see it as a harmless pick, but chronic, excessive consumption, especially as we age, has a hidden side that's rarely discussed, like a long-term medication. Let's explore how this everyday substance can impact senior brain health, and importantly, how to use it wisely, turning it from a potential foe into a focused friend. Let's be clear, moderate caffeine intake can offer benefits like improved focus and alertness. The danger lies in chronic, excessive consumption, especially for the aging brain. Caffeine works by blocking adenosine receptors, the brain's natural signal for tiredness. Constant blocking disrupts your sleep-wake cycle, preventing deep, restorative sleep. This nightly sleep phase is crucial. It's when your brain performs vital cleanup, clearing toxins and consolidating memories. Like tidying up an office after a busy day, when caffeine consistently interrupts this process, toxins can accumulate and memory consolidation suffers, contributing to long-term cognitive decline. Over time, your brain develops tolerance. You need more and more caffeine just to feel normal, not even alert. This creates a dependency cycle, masking underlying fatigue. Furthermore, caffeine causes vasoconstriction, slightly narrowing blood vessels. Chronically, this can reduce overall blood flow and oxygen supply to the brain, a state of mild, sustained hypoxia. While not dramatic, this constant slight oxygen deficit can impair cognitive functions over the years, affecting memory recall, processing speed, and even mood stability. Excessive caffeine also triggers the release of cortisol, the stress hormone. Keeping cortisol levels constantly elevated contributes to chronic stress, anxiety, and irritability. Don't forget caffeine's diuretic effect. It can lead to dehydration and loss of essential minerals if intake isn't balanced with adequate water and nutrient consumption. Finally, emerging research suggests high caffeine intake might negatively impact the delicate gut-brain axis, potentially increasing inflammation and affecting neurotransmitter balance. So while that morning cup might feel essential, understanding these cumulative long-term risks of excess is key to making informed choices for your brain health as you age. So, how can we turn caffeine from a potential risk into a brain ally? It's about being strategic. First, if you're consuming high amounts, consider a gradual reduction, not quitting cold turkey. Cut back by half a cup, or switch one caffeinated drink to decaf every few days. This allows your brain to adapt slowly, minimizing withdrawal symptoms like headaches or fatigue. Second, timing is crucial. Aim to consume all your caffeine in the morning, ideally before noon, and definitely avoid it after 2 p.m. This gives the stimulant effect time to wear off before bed, protecting those vital deep sleep cycles where brain repair and memory consolidation happen. Third, moderation. What's a reasonable amount? For most healthy seniors, aiming for under 200 to 300 milligrams daily is a good guideline. That's roughly 1 to 2 standard cups of brewed coffee. More isn't necessarily better and significantly increases the risks we discussed. Pay attention to sources beyond coffee, like tea, soda, and chocolate. Fourth, consider periodic breaks. Taking a caffeine holiday for a week or two every few months can help reset your brain's tolerance and reduce dependency. Fifth, stay hydrated and nourished. Since caffeine is a mild diuretic, make sure you're drinking plenty of water throughout the day and eating nutrient-dense foods rich in minerals. This helps counteract potential dehydration and nutrient loss, ensuring your brain has the resources it needs to function well. Finally, use caffeine synergistically. The best time for that cognitive boost is before a mentally demanding task or physical activity, but only when you're already well-rested and nourished. Don't use caffeine to replace sleep or good nutrition. Use it to enhance performance when your foundation is already solid. Remember the formula: moderate, well-timed caffeine plus healthy habits can provide benefits. Excessive, poorly timed caffeine, especially without foundational health, equals silent risk. It's about making caffeine work for your brain, not against it. Beyond specific medications or caffeine, remember these universal pillars for protecting your brain health at any age. First, regular physical activity. Exercise boosts blood flow to the brain, stimulates growth factors like BDNF, and helps build cognitive resilience. Aim for consistent movement you enjoy. Second, a brain-healthy diet. Focus on antioxidant-rich fruits and vegetables, anti-inflammatory foods, and healthy fats like omega-3. See description for omega-3 examples. These nutrients protect against cellular damage and provide the building blocks your brain needs. Third, prioritize quality sleep. Aim for 7 to 9 hours of restorative sleep each night. This is non-negotiable for memory consolidation and clearing brain toxins. Fourth, keep your mind active. Continuous cognitive stimulation, learning new skills, reading, engaging in puzzles or brain games like those linked below, and maintaining a rich social life builds cognitive reserve. It's like exercise for your brain, keeping connections strong. Finally, manage stress effectively. Chronic stress harms the brain. Incorporate relaxation techniques like deep breathing, meditation, or spending time in nature into your routine. These simple, consistent habits form the foundation for long-term brain health and resilience, regardless of other factors. So, remember, noticeable changes in memory or thinking aren't always just normal aging. Common medications can play a role, but the most important message today is one of hope and empowerment. Your brain has an incredible capacity to adapt and even recover function thanks to new awareness of potential risks combined with proactive strategies. Diet, exercise, cognitive engagement, and smart supplementation can make a profound difference in your long-term health. However, I must stress this critical point. Never stop or change any prescribed medication based solely on this video. Abrupt changes can be dangerous. Your health situation is unique. Please use this information to start an open and informed conversation with your doctor or healthcare provider. Discuss your concerns, review your full medication list, and explore the safest, most effective options together. To help you on this journey, I've compiled a list of high-quality examples of the supportive supplements and tools we discussed. Things like CoQ10, specific forms of B12 and magnesium, omega-3 South, brain game books, and calming teas. You can find this curated list with links right in the first pinned comment below this video. If you found this information valuable, please give this video a like. It truly helps others find it. Share it with friends or family who might benefit from this knowledge. And subscribe to the Senior Wellness Center for more practical insights on maintaining your health and vitality through the years. And if you enjoyed this content and want to continue your journey to a healthier life, check out the videos appearing on your screen now. I'm sure they'll help you immensely. Click on one of them, and I'll see you there. Stay